Welcome to the Transforming Healthcare Coaching Podcast, where we're all about helping healthcare professionals like you create positive change at work, at home, and everywhere in between.
Hello, everybody. Welcome to a new episode of the Transforming Healthcare Coaching Podcast. As we know, working in healthcare is tough. We have long hours, constant pressure, and burnout is real. And here at Transforming Healthcare Coaching, we share practical ways to handle the stress, enjoy life again, and truly thrive in all areas of our life. Today, I am so excited, part of our celebrations of healthcare professions. I have my very own speech pathology friend, Sarah Gallagher, here with me. And I'm going to let Sarah Gallagher introduce herself to the community today.
Hello, my name is Sarah Gallagher. I'm a speech language pathologist, also known as speech therapist. And I am working in Massachusetts currently, where I do inpatient and outpatient care, pediatrics and adults. And I just moved down from Maine, where I was working in a rural hospital, also working with inpatients, outpatients, peds, and adults. And I'm really happy to chat with everyone today.
So Sarah and I are now both in Massachusetts again.
Yes.
And so it's always so great to have healthcare colleagues and friends in the same area.
Absolutely.
So Sarah, I know a little bit about your speech pathology journey, but can you share a little bit about your journey kind of getting into speech pathology and kind of what inspired you to pursue this path?
So for me, it was pure luck. Growing up, my neighbor is a speech pathologist. And our high school had a program where we could shadow a professional. And she allowed me to follow her, see what the profession is about. And that planted the seed for even what speech pathology is. I was also at the time really into snowboarding, and I followed professional snowboarder Kevin Pierce. In 2009, he got a really serious traumatic brain injury. I followed his journey of recovery from that. I thought, wow, there is a job where you can help someone get back to their life, their connections. And I thought, sign me up for that.
Wow, that is pretty cool.
Yeah.
So that's interesting, especially following the snowboarding path and then like following a guy who suffered a real injury and knowing that you could have some impact in helping him, knowing that you had a connection from a neighbor that inspired you in this journey.
Yeah, and I think it helped open the eyes to, speech is not just in schools. It's also on the more medical aspect where you're working with strokes, you're working with brain injury.
That's actually kind of leads to my next question. And I think that's because even I, in the emergency room, I don't get to work with speech pathology directly all the time. I admit patients to the floor with strokes or dysphagia from unknown source at the time. And I get to read the notes afterwards. And during rotations, I worked with you guys during rehab and things like that. But what do people often misunderstand about your role as a speech pathologist, and how does that impact your work?
Absolutely. So one of the things that often cracks us up as speech pathologists is we come into a room, we introduce ourselves, and the patient says, speech, I can talk just fine. And it happens without fail. And what a lot of people don't know is speech pathologists, that's just a really big umbrella term that really barely scratches the surface of what we do. Of course, we actually do speech, which we refer to as articulation, and that's the production of speech. But we also work with fluency, which people typically think of stuttering. We work with voice, which is amazing because we can work with people who are having voice difficulties, rough voice, but we also work with the transgender community in gender affirming voice and to help people come to a voice that feels more authentic to themselves, which is a newer part of our field. I've been really blessed to go to Emerson College, who actually had that as part of their graduate training, which is amazing. And that's, again, one part that a lot of people don't know that speech pathologists can do. We also, of course, do language, which is in our name. We helping people express themselves. So not only through talking, but through alternative means, like if anyone's ever seen communication via iPad or one of the eye tracking devices, we delve into that. And we also help people to understand language. So it's amazing. But we also do swallowing. So if, again, going back to the stroke, the traumatic brain injury, oftentimes our swallowing muscles become uncoordinated or weak or both. And that can lead to, as I like to say, food or drink going down the wrong pipe. And we basically target avoiding those issues, making the muscles stronger. The biggest thing that people don't realize speech pathologists do is swallowing too. We additionally do cognitive aspects of communication, which is really neat because that targets memory, attention, decision-making, problem-solving skills. And again, that's not in our name. When you hear speech pathologist or speech therapist, it doesn't touch on swallowing or cognition. So I think it's a much more in-depth area that even I've learned so much more about what we can do since getting in the field.
Yeah. You just taught me a lot more of what you guys do, obviously. The swallowing is the biggest thing that I think we're curious about from an ER perspective in the acute phase.
Absolutely.
So I guess I'm curious, like when people don't maybe understand your full scope of practice, how does that impact you practicing in hospitals with other healthcare professionals?
Absolutely. So I think that it definitely creates a little bit more of the quote unquote non-productive work because we almost have to do some of that education ourselves, talking to nurses, physicians, PAs, and kind of explaining what we do. Because again, with that misunderstanding of what we do or what we can and can't do, sometimes we get consults that are more related to another field. So just providing that education on what we can and what we can't do is really helpful for that.
That's good. And I mean, good and bad, obviously. We hope that our colleagues know exactly what we do. So appropriate consults go through. I think everybody does not like the ER for that reason, right? For a lot of people, inpatient medicine as well.
Yeah.
I think the people who have the biggest grasp on this are actually probably outpatient folks.
Yeah.
But I could be wrong, but that's what I suspect. But hopefully this podcast, for those who are listening who do consults, now you know a little bit more about what speech pathology do so that we can order the appropriate consult.
Absolutely. And I think that's one of the reasons why I love this podcast is because it does give you a really umbrella overview of healthcare. It doesn't just focus on one area. And again, even circling back to the consults, it's so helpful because when we're in our training, we're so hyper-focused on our area that we don't necessarily get to consider what other people are doing. So it's really nice to get to listen and hear different perspectives and kind of just see what other areas are up to.
I'm curious, what are some of the biggest challenges you face as a speech pathologist, and particularly around balancing patient care and productivity standards? Because here in this podcast, we like to talk all things well-being and balance and finding a way that works for you.
Absolutely. So I think this refers back to some of our earlier topics, just how big our scope of practice is. I have been very lucky to delve into almost all areas of the field. I work both inpatient and outpatient, both pediatrics and adult. My first hospital that I worked at is a rural hospital, and it was almost in a way a one-stop shop where the patients coming into the door, they could have voice problems, they could have cognition problems, they could have language issues, and you really kind of had to be prepared for whatever came in the door. So that is a big, big learning curve because obviously you learn about all of these things in school, but once you have a patient in front of you, there's still a lot of learning that you have to do. So I think that when there is still so much learning on the job that you have to do, but you also have a busy day booked with patients, it makes it a little bit challenging to do that extra research about this patient that you may need to learn a little bit more about. And when productivity standards are in the picture, I think those little moments of researching more, reaching out to other colleagues who have specialties in that area, those things aren't seen as much on a billing sheet where you say, well, you can bill for this many hours a day, but that's not accounting for the conversations with colleagues that you have, the conversations with the interdisciplinary team that you have, the extra research that you're doing to make sure you're providing the top care for them. So I think that is a really big challenge.
I think a lot of people, especially patient perspective, the people who are not in healthcare or in different fields that maybe don't do the consultations and more so just provide the direct patient care in different ways, forget sometimes that there is much more behind the scenes, whatever field you're in. It seems like you and I have pretty similar fields in terms of our general scope of practice from peds to adults and everything within that field. And as human beings, we cannot remember literally everything.
Yes.
There's times that we need to refresh ourselves and to make sure that we're providing the best patient care. If the patient's right there and they ask a question that you may not know the answer to, but it's an important question that needs to be answered, you got to go look it up. You got to do the research. Then it kind of sometimes puts the next patient a little bit behind. So I think that is something that's shared among other professions, but it's good to know that it's not just my profession.
Yeah, no, absolutely. And I think sometimes, again, the things that are not quite as seen on productivity standards is the phone calls that you make to get the missing pieces of case history. We've all had that patient that's come in and you talk to them, but you still have questions that need to be answered. So maybe you call a family member, maybe you call the facility that they've come from. It is directly impacting that patient care because now you have more of a holistic picture of what's going on with them. But that's not exactly one-on-one time with the patient. So it makes it challenging to balance that. But it's still just as important to do that legwork.
The phone calls, I always forget about those.
Yeah.
And it must be even harder on your aspect, especially if people have the cognitive issues or the language difficulties you had mentioned before. So I have more respect for your phone calls than mine.
No, they're all equally important. Even when kind of just thinking about, what do we do? Like everybody certainly has their own heavy lifting that they have to do that doesn't necessarily fall under the productivity standards of you have an hour or not. We wish we had an hour, but you have this certain time with the patient and everyone does heavy lifting behind the scenes.
So I'm curious, I know you're very passionate about patient education.
Yes.
So why do you find that's so important and how that can impact patient outcomes?
I think that as healthcare providers, we are so well educated on how the body works. Even when there aren't bumps in the road, we know what's supposed to happen. But then it gets even more complicated when an issue arises. And we are so used to knowing information about that we at some point learned that I think sometimes as healthcare providers, we can forget what learning it for the very first time was like. And it's confusing a lot of the times. And I think that if a patient is truly understanding what's going on with their body, they're a lot more likely to be motivated and more compliant with care because they understand why they're doing it. They know what it's going to impact. And I think that can, again, be really motivating to them because they're not just sitting there, well, this provider told me I should do it, I guess that I should do it. They understand why they're doing it. And that, at least in my personal experience, is so much more motivating if I have a reason for what I'm doing.
I like that. And in so many times too, they'll say they understand in the beginning and maybe they just want to get out, they're done. But you really want to make sure the compliance is there so that they do get better in whatever shape, way, or form that you're recommending. And so another thing that I make sure I'm more detailed about now is my discharge instructions. So I'm a very big believer that people need to hear it multiple times.
Yes.
The patients hate it. You go into the room, like, what brings you here? They're like, 3 people already asked me. Can't you just read the notes? I did, but I need to hear it from you.
Yes.
Because that story might change. And how many times it's changed, I can't even tell you. Or you get just more information from that. Like, oh, I forgot to mention this. But so that's kind of history taking. But in terms of the education, I do like people to repeat back to me sometimes. And then I like to write down the discharge instructions. I like my nurse to relay the discharge instructions afterwards. And that way it's like engraved in them and allow for every opportunity to ask questions.
Yeah.
Because I'm a big believer in that as well, that it's the best way to make sure that they get the best care.
It is. And I think especially in terms of people who have communication disorders, all of those things that you're doing are really important because As a speech pathologist, that is my job to uncover what their understanding, what their ability to express is. People are really good at smiling and nodding, and they might present like they're understanding, but at a deeper level, they might not be. A lot of people are really good at compensating to kind of quote unquote get by with their communication disorders. And as a provider doing all of those things that you're doing, that's going to show that they might not understand as much as they present that they are. As a speech pathologist, really happy to hear that you're doing those things, because that does get to the root of, are they understanding? Is this hitting home for them? Circling back to the productivity standards, those all take extra time. But without them, your patient might not be getting the information you think that they're getting.
It's really good to know, and I think it's a good awareness for me, even though as I'm heading into a ER shift later today, just to be more aware of the people, much more cognizant, obviously, with elderly who have a lot of these kind of memory issues and communication issues at times, to obviously be more aware, maybe from people who struggle with maybe the facets of just communication, and just remembering that I need to do everything possible in the ways that I already do, but making sure I'm reinforcing and maybe adding an extra step where I have them repeat it back to me, which maybe I don't always do, I think would be really helpful. So thank you for sharing that.
Yeah. And I think too, one thing about speech pathology specifically is sometimes it's an invisible disability. You can see somebody, but you can't see the brain injury that they've had, or sometimes you can see the stroke, but sometimes you can't. And I think it's important for us to remember to dig a little bit deeper to really their ability to understand and whatnot, because sometimes you can't always see it.
Yeah. And you and I don't know, probably in your inpatient setting, like in my setting, you may not know these people for a long period of time. This may be your first consultation with them. And one thing that stood out to me is what you said was invisible disability. You just don't know their past. And how many times later on, I'm like, is that person okay? The way that they were talking to me, and I go back into the chart and they had a traumatic brain injury in the past, right?
Yeah.
So it's always remembering if something's off, investigate it further.
Yeah. And then I also wanted to comment why I'm so passionate about the patient education is because a lot of the outcomes in dysphagia management, which is that swallowing that we talked about, is shared decision making. So for people who aren't as familiar with swallowing issues, there can be a lot of different things that cause the swallowing issues, and there are a lot of different treatments for those things. For example, sometimes people go on thickened liquids. This is a really hot topic in the field. There's been some publications recently that kind of give thickened liquids almost in a dark light. Sometimes it's not appropriate, sometimes it is appropriate. And that's where the patient education comes into play, because we need to explain to the patient why we're making the recommendations that we are, but make them a part of the decision. Because quality of life, especially with eating and drinking, is so important in food-related things. Food is a very social aspect. It's a very cultural aspect of who we are as people. And if you make recommendations that the patient is simply not going to follow, because who wants to be on a puree diet? Who wants to have thickened liquids? You need to take the time to provide the patient education of why you're doing this. And as providers, we need to educate ourselves. Are they motivated to do this? Do they hate the way that purees are and they're not going to eat them? I'd rather make a realistic expectation recommendation than recommend something that they're quite literally not going to eat. Oh, patient has had 0 intake over the past 2 days. Maybe that's because we recommended puree without talking to the patient about what their thoughts on puree were. We really need to know where the patient is coming from. And again, provide them education of why we're doing that. They might be more okay with having a puree diet for a few days if they know that this is potentially just a limited time thing. You might improve with treatment. They might be able to do it for a few days if they know there's kind of a light at the end of the tunnel. And on the flip side, if someone is so severely impaired that they do need a more restrictive diet, And by that, I mean thickened liquids, purees. If they can understand why they need that, again, the motivation to do it is just so much bigger. And if they understand, well, I don't really want a puree diet and thickened liquids, but if the alternative is not eating and drinking, I would rather do the purees. And again, that patient education to know that they have these options is so important because, again, food and drink, at least for me, are such an important aspect of life in general. Like that's a lot of quality of life comes from food. So we need to be providing patients with the appropriate information to make those decisions for themselves.
Totally agree. And shared decision should happen in every interaction that you have.
Absolutely.
And again, it's the whole compliance with the treatment. And I tell people to kind of be careful, the smile and the nod. They're just trying to get out of there. But it's like, just ask them, how does this treatment sound to you? And then you can even have them repeat it back. So what did I say that I recommend that you do? If you don't do it, I want to know so that I can offer you a different route that could be helpful. So I'm curious with that then is that healthcare is very fast paced. We're trying to navigate the tensions as a result of giving patient education and time constraints and meeting productivity demands. How do you navigate all that?
Yeah, I think just providing, it all goes back to education, I'm feeling. Providing education to the people in charge of those productivity standards of what is, quote unquote, taking longer. Why did this visit take 35 minutes versus 15 or whatnot? And I think that everybody who entered healthcare wants to do it so that patient outcomes can be as best that they can. And if we provide information that what we're doing in the extra time we're spending with patients is to support improved patient outcomes, how can you not support that? I think that it's really easy to agree with the extra time it takes for those improved patient outcomes. And I've been really lucky that I haven't really had anyone that says, no, you shouldn't be spending that extra time to provide that patient education because it is so important in the patient outcome. So I think if there is tension between that, it becomes blatantly clear that it's necessary. It's imperative to the patient outcomes to take that time.
Yeah, I've also been fortunate to work for healthcare systems where that time is allowed to really give the best possible patient care. Because rushing to meet demands in busy departments only leads to potential mistakes and worse patient care, and the experience for the patient is not as great.
Exactly.
I'm curious, what does advocating for yourself as a healthcare professional look like in your day-to-day work? With like advocating for yourself for taking the time that you need for a break? What does it look like for even yourself with patients?
Yeah, absolutely. So in terms of interdisciplinary advocacy, I think in-services are really important. So taking the time to go to other departments, talking about what we do, even introducing ourselves, because if we put a face to the name, it can be so much easier for them to reach out and say, hey, I have this patient, not sure if this is appropriate. What do you think? I think that it opens the door to be seen as more of a resource than just a department. And if the team feels comfortable approaching us and saying, hey, this is what's going on, what do you think? That can be really helpful in improving efficiency. Then we might get an inappropriate consult. It takes time to look through that and see, actually, that's not really our area. Maybe gastroenterology would be a better area for this. And that all takes time. So if we can improve the kind of teamwork that's involved in that, that has been really helpful. And then in terms of just with the patients, I think taking the time from the get-go is really important, because if you start with assumptions and then at the end you realize, oh, they didn't understand anything I just said, then you have to take double that time. Whereas if you just take the time from the get-go to meet the person where they're at, explain them things that are at their level, can be really more efficient in the long run, even though it feels less efficient. I think that in all, it does end up being more efficient.
I agree. And I really like the fact that your field as well is very open to, sharing information, being a resource. It's not like, oh, don't consult me. I don't want to be there if I don't need to be there, right?
Mm-hmm.
I want to be able to offer you whatever services I can that can best help the patient aspect.
Mm-hmm.
The other thing resonating with me was the patient advocacy. And I agree with you wholeheartedly that if you put the time in the beginning, you can oftentimes save yourself from the repetitive questioning. And one of the things too, you had mentioned when you walk into a room, people are like, what speech? I don't need speech.
Yes.
Sometimes for me in my field, it's like I go in, I'm on the PA or the physician associate, I say now more often, or because before the assistant, sometimes for some crowds would be, oh, you're just an assistant. And
Mm-hmm.
sometimes in the beginning, they'd be like, oh, you're going to be finishing school. And I'm
Yep.
just going to work as a provider and ask my questions, do my exam, figure out what's going on. And then at the end of the discharge, oftentimes there'll be another conversation. They'll be like, so when are you graduating? When are you going to medical school? Or when are you going to be a doctor? And I
Yes.
just stamped that down in the beginning and just was like, this is what a physician associate is. Let's move forward.
Absolutely.
That's a good reminder.
Yeah. Yeah, it does. And I think it's interesting how almost hung up people get on names in titles, but it is really important. One conversation in the speech world is, do we introduce ourselves as speech language pathologists or speech therapists? Some people have really strong opinions that I am a pathologist. Saying that I'm a therapist is undermining the education in the diagnostic abilities that I have. But if I go to Joe Schmo on the street and say, I'm a pathologist, they are not going to know what that means. So I think therapist is a really friendly term that people understand. Oh, a therapist, they see what's wrong and then they treat it. I think, at least for me, I don't mind being called a speech therapist, is a lot more easily understood by patient. And I think, again, that's what really matters, is what the patient is taking from it. But it's interesting you mentioned that about your title, because people often with speech therapists, they get really hung up on that title. And I'm like, no, I'm here to help you with your memory.
Yeah.
What does that have to do with a speech therapist? So just helping lay the foundation for who we are and what we do can be really helpful at the get-go.
That's actually really good to know in terms of when I admit patients and tell them what consultations they'll be getting on the floor.
Mm-hmm.
Just to even remember like speech pathology versus speech therapy and the ways that meets the patient and understanding exactly what it is.
Yeah.
Yeah.
Sometimes I've also heard speech pathologists introducing themselves as speech and swallow specialists. So like if you have a patient who's more so having issues with swallowing, that might be more digestible to them. Oh, speech and swallowing specialist. Okay, that makes sense. And then they can better understand why that specialty is there rather than being very confused.
I know that's good to know. I'll have to remember that.
Absolutely.
So I'm curious here as we start to kind of move towards understanding how you as a speech pathologist could be, or a speech therapist, could be supported in our healthcare environment. How can you think healthcare systems better support your field? And those who you really haven't had many of these issues because you've advocated for yourself and for the patient. But maybe for speech pathologists who work in an institution where they want more efficiency over kind of the patient connection that we hint at, how can they advocate for themselves?
So I think that providing education about what we do, again, having people understand our value in the broad scope that we do is really important. I think that using a multi-centered team approach is so important because that can basically help others understand why we're there and what we're doing. And it helps the team kind of understand where we're coming from. If they're seeing a patient who was recommended for maybe a more conservative diet, which would mean pureed, chopped foods, minced and moist foods, which are pretty different than what we're used to getting on a plate. It looks kind of mushy on a plate. It doesn't really look appealing. And if other team members know the why behind it, they might be more apt to kind of following through with it. And sometimes we make a recommendation and the next time we see the patient, like their current diet is different than what we recommended. And then we have to take the time to figure out why that is. And I think if we explain from the get-go why we're doing this, other clinicians might be more apt to support the follow through of it rather than like, oh, the patient was really wanting a giant hamburger right now and this diet didn't allow for that, which that's an extreme scenario for the purpose of just explaining it.
Well, it works because what I got from this mostly was that speech pathologists who maybe work for like an institution not as lucky as you and I are, that are struggling to, you know, really take the time that they want with their patients. It's to involve other parties. It's the education. It's in making sure other departments are aware from like everything you had mentioned before, and as well as your patients, so that they can also advocate for you as well. Like if they're saying, well, I'm not getting enough time with my speech pathologist to really understand just because they didn't
Yes,
understand or whatever. I
absolutely.
think that is a way to let other departments, even within administration, aware of like, hey, can I set up a time to talk? This is what it is that we do, and I just want to make sure this is supported. I think that's one thing that comes to mind for me is just having open professional communication with whether any relevant party.
Yeah, absolutely. That's exactly the point. And I think too, like you said, educating other professions too in skilled nursing facilities, a really big barrier is getting instrumental swallow studies done. And what that means is it's called a modified barium swallow study. And we use a fluoro X-ray room to do imaging, which shows us exactly where the food and drink are going, what our muscles are doing, how our body responds to different strategies. And a lot of the time, skilled nursing facilities don't have that on location. So it's really expensive to go get one done because they have to be transported. They have to get all of those ducks in a row to do that. And I've even heard some people say, well, we like to try a few different treatment methods. And then if those aren't working, then we'll do a swallow study. But to me, that is so scary because how are we going to do the treatments without knowing what's wrong? It's just guesswork at that point. It's like putting a cast on someone without ever taking an x-ray. Nobody would do that. And I think providing education to these skilled nursing facilities about why we need to do these things and why they're so important is really helpful because, again, the evidence is overwhelmingly showing that that is best practice. So ideally, facilities would want to uphold best practice. So if they're presented with the research, if they know why we're doing these things, they're a lot more open to supporting them, at least in an ideal world. If we start treatment off on the right foot to start with, they're being seen for less amount of time. Overall, their outcomes are better because we actually are informed on what treatments that we're doing. I think it is really a no-brainer to support those sorts of things.
Yeah, you just highlight the importance of just continuing medical education, and the recommendations are constantly changing of how we can best provide patient care in certain circumstances. Very important to listen and just keep up to date with the research. And one thing that's come into mind for me too is obviously I see a very wide patient population and a wide array of illnesses. And when I consult, sometimes I get shocked to hear what the recommendations are. I'm like, oh, are these new changes? And sometimes they'll be like, oh, yeah. But it just kind of reminds me, like, maybe I should ask and say, hey, do you mind sending me like a research study that says this?
Yes.
Like for instance, with even appendicitis these days, sometimes certain general surgeons will opt for just antibiotic treatment versus surgical, obviously case by case scenario and different recommendations per surgeon. And it's interesting because I'm like, well, I want to see the research you're reading that you resonate with so I can kind of get a better understanding, right?
Absolutely. And I think that goes back to the whole team approach is if we can understand why other people are making their recommendations, it just provides better patient outcomes because everyone's on the same page. If there's a question with it, if they're not able to produce why they're doing it or research to support it, then maybe that's an indication that we should be taking a different route. So I really do think that collaboration is so key for the patient outcomes.
Yeah. And this goes kind of back to shared decision making too. And if you're a patient listening to this, be an advocate and you can always ask for the research so that they can see it as well, because they should 100% be in complete understanding and open communication of, "Hi, this is new," or "I'm not sure, I've never done this before, but this is what the recommendations are nowadays. How do you feel about this?" I think always keeping communication open and free.
Yeah, absolutely. I have a patient that comes to mind when you say that. She was so involved in her care. She was so enthusiastic, and it was regarding an area that I hadn't treated before. And I was very transparent. I say, "This is new for me. I hope that you're okay with taking this journey with me because it's a learning experience for me too." And she was really excited for that. This is the approach that's best practice right now. This is what we're going to try. We'll see how it works for you, and we can make tweaks along the way. And she was so thrilled to get that information because that also made her a part of the treatment. And again, I think that goes into the buy-in of if she understands why I'm making these recommendations, she's so much more likely to follow through with them because she can understand where they're coming from. I think that it's important to meet the patient where they are and what their ability is to take in information, because probably I wouldn't be able to send a research article to just anybody and have them understand it. She's a highly educated patient, and I felt confident that she would be able to understand this. But for a patient who maybe has a lower literacy level or a harder time with taking in information via text, I would definitely still make that information accessible, but in a different way. Maybe I would explain it, or maybe I would show a visual. Maybe I would show them why we're doing it that way. So I think understanding where your patient's at and their ability to take in information is key too. But you can hear how excited I get about it. I love
know.
it.
I love hearing it because I share a lot of these passions as well, and I think many of our audiences do as well. I'm curious, you seem very busy with the work that you do. How do you balance it all? How do you maintain your own well-being with all the emotional and professional demands of your profession?
I think there's multiple aspects into that. I think keeping open communication with your managers to say, "Hey, this is where I'm at. I'm starting to fall behind with my notes. What can we do about that?" And hopefully, if you have a supportive manager, they'll work with you. Again, it goes back to that advocacy of, "This is where I'm at. How can you help me?" And sometimes you have to be persistent with that. Sometimes you have to go to the manager multiple times to address it until they're like, "Oh yeah, this is actually becoming a little bit of a problem. We need to set aside some time to address this." And just advocating for yourself and knowing that what you're doing is important and that you do deserve that time, I think makes it easier to advocate for yourself. Because if you go to them and say, "Oh, I need more time just because, I don't know, it's not really working out for me," that's not going to get you anywhere. But if you say, "I spent this time finding extra YouTube videos for them because they weren't able to read, so this is why I need maybe an extra half an hour at the end of the day," or whatever it is. Again, ideally, in a perfect world, your manager would support that. I do understand that there's logistic barriers that sometimes make that a little bit harder, but I have found persistent advocacy can be really effective. So that's kind of the at-work part that you can do. Advocate with your managers, explain what you're doing, keep communication channels open. But at home, what I do is I actually see a professional therapist. Shout out to her. She's amazing. She's helped given me a lot of the concrete strategies and tools to have a happy work-life balance. And basically, it's a lot of meditation. I'm not connected with this app at all, but I personally use Insight Timer. It has 2-minute, 3-minute, 5-minute meditations, breathing strategies. And even on the car ride home, you can just do a nice little breathing exercise, and it kind of helps let go of the stress throughout the day. Yoga is really nice. I don't go anywhere to do it. I pop a YouTube video, Yoga with Cassandra, up. Again, has nice short little ones. Oftentimes I just get home and do a 10-minute yoga video. And even that's enough to kind of calm my nervous system down, say, "Oh yeah, you're at home. This is a transition. Stop thinking about that work." It can be really helpful because we work in a field that can really easily be all-consuming. We care about the patient, so we want to be thinking about them, but that's not necessarily healthy. So one of my favorite meditation strategies is this idea of if you have thoughts that up in your brain, to kind of just let them go. It's okay to have those thoughts, but just acknowledge you have them and then let them go. Don't keep grabbing onto that thought and holding onto it. There's a really funny analogy that if you're in an aquarium, you can watch the fish, you can acknowledge they're there, but you're not going to reach in and grab the fish. Don't grab the fish. Let that fish go. Let it swim along. It's the same with our thoughts about work when we're not at work. Don't hold on to those things. And if the more you practice just kind of letting them go, the more you can be more present in the moment. So I would say that at home, those are my big things, just being really deliberate in leaving work at work and being present in the moment.
These are incredible strategies. I appreciate that. And I resonate with them completely. When you're struggling at work, recognizing that you're struggling is okay. We all have some challenges. Being open to our managers is, I think, a great first step in a very professional way, as you mentioned. We want to see each other succeed. We want the patients to get the best possible care. So most likely it's going to be met with some kind of, let's set aside some time, or let's figure out how I can help you. Your manager's likely been there before or has experienced another clinician with a similar issue. So they should be able to help you with at least guiding you in the right direction.
Absolutely.
But I agree with you, as I hit home a lot on this podcast, is balancing the home life with the work life. Sometimes you just can't 100% get out of it. But
yes,
most people that I've worked with as a coach struggle with letting things stay at work, or just the work may not be following the home in the essence of just thinking about patient care, but just the overall exhaustion and to give to a patient who's really sick, or even just an angry patient or family member can just ruin their day and the days to come. And they just think about it so much. Burnout over time leads to just this increasing anxiety and stress. So mental health is very affected for most of us. Just know that you could ask for help. And it's not, there should never be a bias behind it. There shouldn't be a stigma, but there is for a lot of healthcare professionals. They like to say, like, well, I can care for other people. I can care for myself. I always tell people, and my healthcare patients always, I'm like, you're the worst patient and I'm the worst patient. Because they'll be like, yeah, I'm not going to do what you said, or whatever it is. And so therapy is such a valuable field. It's a very valuable service that I think many people can benefit from. And many therapists actually do a lot of the stuff that we do as coaches. We're not therapists. We do not provide mental health care, but what we say we do is therapeutic in essence. A lot of what we do is very forward thinking. It's all taking you from where you are to where you want to be, and very focused on a goal system, creating systems and sustainable habits that work for you to achieve a big overarching goal. So it really works for the motivated person, or the person who's burnt out, that says, I know I want to change. I just don't know how to get there, but I know I want to do it. And sometimes it's a combination of therapy and coaching.
Yeah, absolutely. And the more resources and the more strategies you can get, I believe the better.
So healthcare systems, if you could think of a way where you could redesign a system to support both patient care and clinician well-being, what changes would you make in general?
Yeah, I think that it goes back just exactly to what you're saying is about the burnout. I think one thing as a system that really needs to happen is include more people coming into the field. Especially speech pathology is not a diverse field. It's a really big problem that we have. I think that doing outreach to have a more diverse kind of pool coming into the field would be amazing, because the more speech pathologists we have, the more people that we can get onto the floors doing this work. If you have one person that is tasked with seeing a whole entire caseload, that's really overwhelming. The productivity does have to be higher. But if you have two people seeing that same caseload, then you have much more time to do those behind the scenes work. Again, if we can make that pool even more diverse, you're reaching a whole lot more of the patient population. So I think that's a really big thing that has to be redesigned in the system. We have to figure out a way to get more people introduced to the field. Like I said, I came into this field by pure chance that my neighbor is a SLP, that's short for speech language pathologist. I think getting the word out about what we are, who we care for is really important. But the second thing is managing that burnout better, because some people come into the field, we love what it stands for, we love what we do, but with those productivity standards, we get burnt out, and some people end up leaving the field because of it. That's an extreme case, of course, but I think the system needs to be more aware of supporting anti-burnout through whether it's healthcare coaching, making more realistic productivity standards, having more people on the team to help with it. I think all of those things could help with that overall.
Yeah, these are all great strategies. They say that there is an increasing aging population and less people going into healthcare. And so I do think it's very important because I think just ties in with burnout is I even hear of my colleagues or even just in general healthcare professionals who are telling healthcare people like, no, don't go into my field. Like you're going to be burnt out, or they see that they're so burnt out and exhausted and they don't want to go into the field.
Absolutely.
And it's
It
like,
is.
no, like what we do is so admirable. I know we forget about it sometimes, but the work that we do is amazing. And we do change people's lives, even though you may not see the impact of it initially. And we need people in healthcare. And things are changing, and we need new innovators in our fields to make changes as technology is growing and whatnot. And then you're right, we on this podcast and this coaching team are so very big advocates for provider well-being and healthcare professional well-being from every role in healthcare, and that we deserve better. We deserve to have that awareness and understanding from the healthcare systems so that we can just live happier, healthier lives, and then translates to a better patient care experience. It translates to a positive work culture. There's so many other probably unintended benefits that they didn't see when you start to really treat the healthcare professional as a whole and as a human being. I think that's the thing. We're humans too.
Apply the same things that we preach to the patients to ourselves. I think that's key. Take care of yourselves.
So if you could give one piece of advice to healthcare professionals who are looking to create more meaningful connections with their patients or are looking to get some kind of help or want to give any form of advice to other healthcare professionals who are not as familiar with the speech pathology or therapy field, what would it be?
I would just say take the time. It takes maybe 5 extra minutes to sit down with the patient, get to know them just a little bit more. And just in those 5 minutes, you can learn so much more about them and about their level of understanding, about their level of expression that they have. That's going to serve you to have an educated kind of approach with this patient of what they need, where you can meet them. And it feels sometimes in the rush of the day that we don't have the time to do stuff like that, but just take the time. It really doesn't make too much of a dent in your day, and it can make an entire difference in their whole stay if you just show them that you care, that you want to connect with them, that you're willing to take the time to actually check in with them. And I think that can really support the connection that you have with the patient in front of you.
I love that. And the other thing I would add on to that is your introduction. And I think this probably speaks for a lot of urgent care folk is that you ask your questions and then you decide to go back, order some tests, and you're like, oh, maybe I should ask this question. Just spend the initial time to get the entire story, even if it takes a little bit longer. And because productivity wise, going back and forth is not the most productive thing. And it obviously creates a better patient care experience as well. So thank you for sharing that.
Yeah, absolutely.
Well, Sarah, it was a pleasure to have you on the podcast. If people want to connect with you, do you have any way for people to connect? Do you use like LinkedIn or anything like that?
So I actually don't have a LinkedIn. I have a really outdated one that I should probably get up on. As you can tell, I love talking about anything speech. So I would be more than happy to connect with anybody who's out there that might be listening and wants more information, or even if they know someone who is thinking about getting into the field, but they're just not quite sure if that's what they want to do. I love talking to potential students who are interested in the field, I think it's really helpful to have someone they can ask questions to and get a better understanding of the field before they decide to go into it. So send them my way.
I love that. So yeah, if this resonates with you or you know somebody who's interested in the SLP field, send a like, subscribe, and share with a friend on this podcast, and send a comment as well, and we can connect you with Sarah.
Absolutely.
right,
Thank you
Sarah.
so much, Klaus. I appreciate the time you took with me today.
Oh, no problem.
Thanks so much for listening. If you found value in today's episode, please subscribe and share with a colleague who would benefit. Together, we can transform healthcare one person at a time. Find us anywhere you find your podcasts. Ready to take your healthcare leadership journey to the next level? Book a discovery call, free, at transforminghealthcarecoaching.com to explore our personalized coaching packages designed specifically for healthcare professionals like you.